Welcome and thank you for joining me. My name is Dr. Inbar Young. I'm a licensed clinical psychologist in the states of California and Ohio. I would like to spend a few minutes talking to you today about somatic experiencing. Somatic experiencing is a cutting-edge body-mind approach developed by the renowned Dr. Peter Levine in a way to help us understand and treat trauma and severe anxiety disorders in a more effective, quicker, and a global way, addressing directly the nervous system. The idea behind somatic experiencing is that when we experiencing trauma, our body goes to a fight, flight, or a freeze mode. So there is all of this energy that gets locked in our body. If you look at animals, like Dr. Levine pointed out, animals are able to go through the trauma process and then transition quite effectively by shaking and moving on. Unfortunately, as human beings, we don't do that. And that gets us in trouble. That's when we see all of this energy gets locked in our body. And without the discharge, we get into trouble. Somatic experiencing allowing us to work with the autonomic nervous system. We are looking at the sympathetic and the parasympathetic, a reaction that our body naturally does. So the idea behind it is that you learn to first feel safe within your own body. You learn to regulate yourself by slowing down and listening what feels good, where do we have activation, and where do we really feel good. In somatic experiencing, we approach trauma in a very gradual, careful way, where you have control of how much or how little you're going to be working with. It's really a biological approach. By utilizing somatic experiencing, we no longer need to revisit the trauma over and over again. And that can prevent re-victimization that we see in some cases. I've been practicing for close to 15 years now, and I always felt that there was something missing. So I had a psychodynamic background, I had a cognitive behavioral background, but with trauma, I just felt it was just taking too long. Somatic experiencing allowing us to find another path that a lot of people is just easier or more natural. So you no longer need to describe the horrors of your experiences over and over again. You basically sit and you use the story as a way to find where in your body that story registered. We looked at our body as a memoir, right? I always say the body remembers what the mind tries to forget. So now we have another piece, and that's utilizing the body in a way to release all of that energy that got locked inside. In therapy, you start first with what feels safe to you, with what feels comfortable. You form resources, so you will have all of the coping skills you need to revisit those other memories. And we use titration, meaning we're doing things very, very slowly, and pendulation. We go back and forth between the areas in your body that feels activated. It may be your tense chest or trembling palms or tight legs, and what feels comfortable and safe. Maybe you will find out that you like to stroke your hair as a way to calm yourself down. Maybe light pressure feels good, maybe putting your hand on your heart. So we are really working with our body as a way to channel into your core self so you can be free again. This is just an introduction to this marvelous and really cutting-edge approach developed by Dr. Peter Levine and really revolutionizing the way we see and treat trauma. Thank you for joining me.